So today we're going to be looking at our case study submission report number 2. We are still following Evelyn for our MS patient, and we're just going to be looking at some exercise modalities that could help to further improve her condition as well as learn how to manage it so that she can live her best quality of life. And then part of this case study that we're going to be looking at is we're just going to be going over an overview of the patient assessment. So with Evelyn, she is going to be a 50-year-old woman who has recently just completed her physical examination. Within this screening, a lot of her tests were in normal ranges. Her total cholesterol was at 190, where fasting glucose was at 106. That resting blood pressure was 188 over 78, which is a little bit of a heightened experience right there. Her resting heart rate was at 76 beats per minute. Waist circumference was at 31, and then her height was 62 and weight was 135. So all of those were within normal ranges for that height and weight component as well. Following that, with the further medical evaluation, she was then diagnosed with relapsing remitting multiple sclerosis. With this, we did look at a disability classification, so looking at the expanded disability status scale of 2.0, indicating that she did have a mild disability with her treatment plan. Following that, her prescription that she was given by her physician was teleflunomide. So yeah, do you want to go ahead?
However, there was no specific exercise prescription provided. In terms of activity, she's an avid golfer who participates in a league every Saturday. In addition, she walks her dog for about 10 minutes every single morning and evening. Outside of these programs, she does not currently engage in any structured exercise or regular physical activity program.
We are still on that patient assessment. However, we're just looking at a couple of different tests, such as that grip strength, the best test, ankle dorsiflexion, and then also plantar flexion. 5 kilograms for that right hand of her grip strength. That best test did show 17 errors. Dorsiflexion in her right ankle was 9, whereas the left was 11. And then for plantar flexion, the right was 42, and then the left was 43. With that, we have indicated that there were some noticeable changes within her balance, proprioception. And these results that we are seeing here help to kind of clarify maybe what things could be lacking within her systems. Through this test, we were also able to see where maybe she could be lacking in a sense of movement and being aware of a good decline within coordination potentially. In addition to this, she did express concerns about the gradual decrease within her grip strength, and we would like to kind of further assess those concerns through potential later evaluations as well. Because they're trying to get her back to being able to play golf.
These findings suggest that she has mild limitations in her ankle mobility, which can contribute to balance deficits. With these results in mind, Evelyn has asked for guidance in developing a home-based exercise program that can help her balance, increase her grip strength, and better manage the physical effects of her relapsing remitting multiple sclerosis.
Moving on, we have this first study is going to basically examine the effectiveness of seated Pilates for individuals with mild to moderate severe multiple sclerosis. So the main purpose was to see whether or not this was a feasible modality, was it beneficial for these patients, and potentially where their improvements could be made within their lives. So the methods that were involved within this, it was an 8 to 12 week program. The interventions completing low to moderate intensity seated Pilates movements, and then they would do it between 2 to 3 times a week. As long as the patient was permitting of these exercises and they were able to do so. Each patient's going to be a little bit different in what they're able to tolerate, so they did make sure to implement that as well. By doing these seated, it provided a safe environment for these patients so that we're not looking at fall risk. And it also helps, since a lot of them are dealing with balance issues, by being seated, that kind of helps to calm everything down. It gives them that extra barrier just to make them feel the most comfortable with performing these exercises, and also make sure that they don't feel too fatigued with doing this, because overall we're just here to manage it and treat it. We don't want to put them at a worse point than they are. And then resulting kind of looking at just outcomes within the article, a lot of patients had very positive feedback from this methods. They demonstrated improvements within their mobility, postural control, as well as their trunk stability, which were all phenomenal things, since even within in this case, these are some of the things that she's also struggling with. So we do think that this could just be a really good overall method for her to utilize.
From an application standpoint, the study supports the use of seated Pilates as a neuromotor-focused, low-load exercise intervention. It's especially useful in the early stages of an exercise program or for individuals who are experiencing significant fatigue, weakness, or limited mobility. It's a strong option for rehabilitation settings and for exercise professionals working with clinical populations, which goes into the strengths of the study, which includes participants with a wide range of disability levels and its increase in clinical prevalence. The improvements are also functionally meaningful, and the high feasibility of the program is super important to the MS population, where adherence and tolerance to exercise can often be challenging. However, there were several weaknesses for the study. It had a small sample size, which is common in pilot studies, but limits how broadly the findings can be applied. There was also restricted progression of exercise intensity, which can limit long-term physical adaptations. In addition, the study didn't include a long-term follow-up, so it's unclear whether the benefits were maintained over time. But overall, the study suggests that seated Pilates is a safe and practical and effective starting point for improving mobility.
It's just looking at how the individuals within the study, how they felt during and after it, and do they feel like it showed true improvements within it.
Our second review of literature looked at whether a 12-week integrated yoga program could be safe and effective for individuals with relapsing remitting multiple sclerosis. Our purpose was to assess both the feasibility of the program and its preliminary effects on physical and psychosocial health outcomes, including balance, fatigue, depression, anxiety, and stress. The researchers used a non-randomized control pilot study design, which measured before and after the intervention using standardized assessments such as the Berg Balance Scale, the Fatigue Severity Scale, and the DASS-21 for depression, anxiety, and stress.
And to kind of look at it from a different standpoint, application-wise, we saw that the yoga was a great thing to implement. However, we would implement it in combination with other therapies as well. We just found that to be the best way for it to work, just since it is a more of impact exercise modality. The exercise professionals and rehabilitationists found that the yoga is practical to, and also increasing their confidence within their activities of their daily life, just making them feel that they are more stable and more able to go further, as like with yoga, it's increasing like their strength as well as their flexibility and things of that nature. Participants themselves are very happy about their outcomes and very happy about the way they have been feeling with the yoga is helping not only strengthen them, but also provide them with flexibility and give them the opportunity to do some things that they potentially had been working on as a result of MS. In addition to side though, for some limitations that this study did show, or some weaknesses, is that we did have a small sample size. There was only about 30 participants, and it was also a non-randomized study. So although the results did show great effects and the participants were happy, there is that potential chance of like what if, just due to the non-randomized study. However, overall, this study did just kind of encourage us in implementing yoga as well, just because it had both the physical and the psychological health benefits as well, just because it was giving those patients more confidence and the ability to do more as well, and just feel more good within their everyday life and have a better quality of life overall.
Table 3 showed the effect of 12-week integrated yoga module intervention on measurement scores. In the IYM group, paired t-test showed significant improvements across all outcome measures following intervention. The best scores increased significantly, whereas fatigue, depression, anxiety, and stress scores all decreased significantly. In contrast,
two different kind of modalities in a sense of looking at HIIT exercises, so that high intensity interval training, and then we used it in combination with a list of exercises that they would perform at home. So with it had 29 adults with RRMS, and then we looked at kind of their ambulatory abilities, some who had minimal disabilities, and then some who just had RRMS with no disability, and we're all good to go. Or also, in addition to that, so the first group will say they just performed the exercises twice a week, and then in addition, they had a list of exercises to perform at home. Group number 2 had a very direct home exercise plan, and they had to perform that 6 times a week. And then with our third group, they were the control group, and then they didn't participate in any of the exercising.
The program lasted 40 weeks, and participants were assessed at a baseline, 20 weeks and 40 weeks. Outcome measures included VO2 peak, the 30-second sit-to-stand test, the balance assessments, fatigue scales, and quality of life questionnaires, anxiety and depression scales, and measures of disease progression such as EDSS and relapse rate. The results showed that the exercise programs were both feasible and safe with a 79.3% completion rate, and the supervised group showed the greatest benefits. After 20 weeks, participants demonstrated a significant improvement in cardiorespiratory fitness, lower body strength, and functional performance. Also had a much better adherence with the 7 of clinical outcomes. There were no worsening in EDSS scores. Relapse rates decreased in the supervised group, and no negative symptom progression was observed. The study has strong application to clinical exercise prescription, especially for the case like Evelyn, who presents with RRMS, mild strength loss, and balance and proprioceptive deficits. The findings support the use of a progressive supervised exercise program that includes study is that it's a 40-week long intervention, which provides a much better insight into long-term exercise effects. It also directly studies RRMS patients with a disability level similar to Evelyn's, which including a control group, and reported a strong safety and adherence data. However, there are some limitations. The sample size was small, with only 29 participants, and the study was not randomized because participants selected their own groups. This introduces the possibility of selection bias. In addition, adherence in the home-based group was much lower, and quality of life outcomes were not significantly improved. Overall, this article strongly supports supervised structure exercise as a safe and effective intervention for individuals with mild RRMS.
And following that, we do have one more figure to show for this article. So this is going to be looking at the evolution of the lower limb strength along with intervention in the combined face-to-face group. So we're looking at that, and then we're also looking at the home-based group as well as the control group during the whole evaluation of this. And then kind of the differences between the groups that are shown. So we are looking at a 30-second sit-to-stand test, and we're just looking at how they were before and after performing the modalities. So within the test, higher, and it showed that the HIIT modality in combination with the home exercises was beneficial for the patients.
For Evelyn's exercise program, we're going to start her off with a clock reach balance drill where you stand on both feet and tap 12, 3, 6, and 9 with one foot, and then progressing with standing on one leg while reaching with the opposite foot. She will be performing 2 sets of 5 on each leg, and this exercise will improve her balance and proprioception. And then we're going to have Evelyn do the farmer's carry, and she's going to carry 5 to 8 pounds for a short distance. And then for progression, increasing weight or performing single arm carry, and she will do 2 to 3 sets, depending on her progression, for 30 seconds. And this will increase her grip strength, posture, gait, and stability, and core strength.
Following that, we have her doing lateral banded walks. With this, she'll place a resistance band above her knees, and then she'll walk about 10 steps 2 times. And then she'll also can do this to progress it with a band as well at her ankles. With doing this exercise, it kind of help to improve her hip stability, but really help to fire on those AB ductors, and then as well as control her gait. For our next one, we'll have her do medicine ball rotations. She'll be seated or standing with this. We'll have her seated just for balance mechanisms, and then she'll have the medicine ball in her hands, rotate side to side. In addition to that, if she would like to progress it, then we can have her going at the diagonal pattern as well. When she performs these, she'll also perform them twice, but she'll do 10 times each side. This is helping with those cough mechanics as well as with her trunk stability.
Yoga or towel scrunches. She will scrunch a towel with her toes while seated, and then for progression, perform standing or with a single leg. And she's going to perform 2 sets of 15. And this exercise will increase her foot intrinsic strength and proprioception. Her next one will be the step matrix drill. She will step forward, side, and back. And for progression, adding diagonal, multi-directional steps. And she's going to do 2 sets of 5 each direction. And this will increase her dynamic balance and coordination.
Moving on, we're going to be looking at wall push-ups as well as our grip squeezes. We are going to be looking at this from upper body perspective because we need to work out the whole body. So she'll be doing some isometric push-up holds, and then to progress, we'll add in tennis ball squeezes during that hold as well. She'll be performing these twice for 20 seconds each, and this will just work on the upper body stability as well as that hand grip strength. And then following that, going back to our golf mechanics, we are working on the golf stance weight shifts. So we'll have her control it from side to side, shifting within between the different stances of the golf position. And then to progress, we can add in a club and then add in some rotation to work on that core as well. So with this, we'll be doing 2 sets of 10 shifts. And then this is just kind of a sport specific modality to kind of help with her balance as well as regain that confidence.
All right, so some education and follow-up for Evelyn can include fatigue management and energy conservation. Fatigue is one of the most common MS symptoms, so teaching energy pacing is essential. We will educate Evelyn on pacing strategies and energy conservation techniques to reduce fatigue-related symptom exacerbation and to improve her adherence. Fall prevention and home safety is another one because balance and proprioception are changing. Education on safety is critical. This directly supports better outcomes. The next one is symptom monitoring and self-awareness. We're going to teach Evelyn to track her fatigue levels, dizziness, leg weakness, balance confidence, grip fatigue during golf, and symptom flare-ups. And we're going to have her do it on a 1 to 10 fatigue scale, 1 being this will help progression decisions.
In addition to that, we're also going to teach her about heat sensitivity, just because it's very important with MS, as if they're exercising and their body temperature rises, it can just lead to worsening of the symptoms. So some things that we need to be mindful of is like exercising in a cool room, utilizing fans, staying hydrated, wearing light clothing, also light color clothing if you're going to be outside exercising, just so that we can stop those symptoms from worsening. Following that, we're also going to do the importance of consistency. So like with anything, you want to be consistent so that your improvements stay and that you are managing those symptoms as well. The consistency also helps to kind of reassure that she is doing what she needs to do to help improve herself, because if she's consistent, she's going to continue to see those improvements as well. So that can just help to make sure that her strength is improving as well as her balance, and then her fatigue isn't worsening or she's de-regressing either. And then lastly, we have our lifestyle behavior education as well, because your lifestyle is everything. So making sure that you are taking time for yourself, making sure that she's slowly increasing her daily walks, maintaining a healthy weight, eating healthily. So, and then also being consistent within her activity to help that overall cardiometabolic health as well.
Follow-up assessments will occur every 2 to 4 weeks to monitor functional improvements, symptoms tolerance, and exercise progressing to ensure safety and to minimize relapse-related fatigue.
And then thank you for listening to our presentation today about Evelyn and multiple sclerosis. We have our other contributions at the bottom. And then following that, we also have our resources.
Thank you.
Have a great one.